Hey, how's it going? My name's Ben. I'm the discharging nurse, and I'm helping you go home today. Your doctor explained to you what Addison's disease is and what we've done for you while you've been in the hospital. So I just wanted to explain to you what's needed to manage your Addison's disease going home so you're not overwhelmed. Is that okay? Great. So what the doctor has given you is called hydrocortisone and fludrocortisone. You take one hydrocortisone tablet 3 times a day with meals so your stomach doesn't get upset. You also take the fludrocortisone tablet once daily when you wake up. So these are pills you take to help increase your blood pressure and regulate your hormones, which are low in Addison's disease. When you go home, I want you to see your doctor. If your clothes start fitting tighter, or if you notice any swelling in your body, like your ankles or feet, because that might mean that you're taking too much medication. If you're not taking enough medication, you may notice you get dizzy standing up, or you may begin to crave salt like you did when you first came to the hospital. So see your doctor about that too. Take an additional dose before any procedures like going to the dentist, as the increased stress from these procedures can require your body to need more cortisol to function properly. If you get sick, you may not be able to take your regular dose orally. I have an emergency kit here with a liquid form of hydrocortisone that goes in your muscle. So I want to demonstrate you how to use it. Is that okay? Great. So you've got 2 mils of water here and a vial with powdered medication. You've got a syringe with 2 needles, one sharp and one dull, and some alcohol swabs. So I'll take off the first. You take off the top part of the packet for the water. You take the blunt tip needle and you screw it onto the syringe. You insert the needle into the water and then you draw it out. You insert the needle into the vial and then you squirt in the water. You take the needle out and then you mix the solution between your palms of your hands to get all the powder dissolved. Then you reinsert the needle and you drop the medication and then you remove it from the vial. You take off the old needle and then you screw on the sharp needle and you set it aside. Then I want you to lift up the side of the shirt on your arm. Go 2 fingers down from your shoulder. Take your alcohol swab and clean 2 finger widths down, and then just leave the alcohol swab there just for a reference point, so you know where you're going to poke yourself. With your thumb on your arm, I want you to pull the skin back on your shoulder so it's easier for the needle to reach your muscle. Take the needle and insert it like a dart into your shoulder muscle. Press down on the lever to administer the medication. Take the needle out and place it somewhere safe where you can't stab yourself. Apply pressure to the site for a few seconds in case you start bleeding. And then I want you to get rid of the needle in a sharps container, which I got one here for you to take home. And that'll help. So this will all help with you when you can't take oral medication when you're sick. The best way to prevent getting sick is washing your hands. Wash your hands as often you can. Anytime you touch anything foreign or anything like that somebody else has touched, and avoid touching your face after touching objects like doorknobs or chairs or the like. Be especially cognizant of hygiene when you're out in large crowds of people. You don't have to, you're 23 and you've got like lots of stuff you want to be doing, and you can't just sit at home, right? You don't have to avoid weddings or malls or concerts, but just be mindful of hand hygiene and not touching your face and stuff like that, and staying away from people who might be sick. And and don't get stressed out about getting sick either. If you do have symptoms like an upset stomach, nausea, vomiting, increased, you need to pee, feeling you need to pee more, or it hurts to pee, or you have a new cough or fever, then come see your doctor. Um, and I have you can pick up, suggest you pick up a thermometer at the pharmacy so that you can check your temperature regularly. I think that would come in handy. Um, I read in your chart that you live in an area with crowded housing and you're looking for a less crowded place to live. Our social worker on the floor can help you by walking through the housing. They can walk you up through the housing search process. They can help you apply for subsidized housing because I know you mentioned you were tight on a budget. They can help you with booking viewings and searching for good deals on apartments. Um, So I'd just like to get your permission if I could reach out for her. Okay, awesome, great. So what's your preferred method of communication? Phone? Okay, great. I'll get in touch with her and I'll ask her to get in touch with you via phone call. Does that sound good? Okay, sweet. I also want to get in touch with you regarding emotional concerns. So I know having a new diagnosis is scary, and especially when you're diagnosed with like a rare disease like Addison's, it can seem like there aren't that many resources out to support you. The Canadian Addison Society offers support for Canadians living with Addison's disease, and they have group meetings. They have info and they have group meetings for people with Addison's to talk to one another, discuss living with their illness and ways they've managed to work around and deal with this illness. The chapter representative for the Atlantic provinces is Anne Marie West. With your permission, I'd like to reach out to her on your behalf to see if she can help connect you with resources to help manage your illness. Would that be okay? Great. Okay, I'll get her to give you a call. Great. Okay, so do you have any questions for me? Okay, so you asked me if these medications will make my symptoms go away. The medications will help decrease the severity of the symptoms. They won't entirely go away, and the symptoms can include fatigue and nausea are the most commonly reported symptoms. You said you're a full-time videographer who travels a lot for work, and you're wondering if you'd still be able to do the things you used to do, like traveling and carrying camera equipment. You can do those things, but you're more likely to get tired more easily and to require more rest than before. You should have really have the intention to have a good work-life balance to combat your fatigue. Meaningful activities like like working this job that you love, can help increase your energy and mood and combat your feelings of fatigue as well. The doctor told you that you're telling me that the doctor told you you needed to take extra medicine for stressful situations like going to the dentist, but you don't get stressed out by going to the dentist. You get stressed out by totally different things, and you're wondering if you still have to take the extra medication. That's a great question. You don't have to take medication before going to the dentist if dental procedures aren't stressful for you. You should take extra medication for other procedures or events that stress you out, whether that is public speaking or going for, I don't know, a kidney operation. Um, okay, so you're asking me if you'll have a shortened lifespan because of this disease. No one can say for certain how long a patient with Addison's has to live or anybody has to live. But that said, with treatment, people with Addison's can live full and meaningful lives and live as long as anyone else. Should you disclose this illness to your employer? Um, that's up to you. I mean, if you start missing days off work or you need accommodations in your workplace, maybe you'd want to tell your employer about your illness. Otherwise, I think it's up to you whether you disclose or not. You know, some people find their employers are accommodating, and some find that they just don't understand. In which case, you don't have to disclose. No other questions for me? Okay, awesome. That's great. So mine, you know what? I'm gonna get. If you have any further questions or anything like that, feel free to reach me at 999-9999, um, and I'll get back to you as soon as I can. Great. Have a great day. Bye.